Welcome back to this channel. Today we will talk about the age criteria for geriatric care. In the developed world, the age of 65 and above is considered geriatric. In less developed countries, especially like India, where there is a lot of diversity in the socioeconomic status of the people and living conditions of the people, generally age of 60 and above is considered geriatric. Having said this, it is important to remember that the problems of aging does not always begin sharply at one particular age. It will depend on the kind of genes one has inherited, the kind of lifestyle one has led, the kind of life events one has faced, for example, adverse events like accidents, etc. So a number of factors go on to determine whether a person needs that kind of care which is reserved for the elderly. Then geriatricians also tend to further subclassify people in the geriatric age group as the young olds, the middle olds, and the old olds. The young olds would be someone from 65 to 75. In India, you could say 60 to 70, or the middle olds would be from 75 to 85, or in India, 70 to 80, and the old olds are 85 and above, or in India, 80 and above. The reason geriatricians do this is that the kind of problems will differ in these subsets. The young olds are relatively healthy, active, functional. They may have number of chronic diseases by then, but they are usually very functional, and the focus would more be on preventing further problems and helping them to age gracefully. In the middle olds, the problems of aging, like cognitive impairment, that is mental deterioration, the unsteadiness, problems like incontinence, and other problems more associated with aging would begin to make an appearance, and geriatricians have to tackle those as well, and to prevent further deterioration or reduce the pace of deterioration and keep the people in a good health status. The old olds are, as one can imagine, would be more frail, more prone to accidents, falls. The incidence or prevalence of cognitive impairment or mental impairment would be much higher. So the kind of problems one has to deal with would also differ in this subset. There is also a term called pre-geriatric. So usually that would be, say, 50 to 60 or 50 to 65 years old, people who are, just beginning to reach a stage where if one takes adequate care, many problems can be prevented later on. But as I say this, it is always useful right from a very young age group to follow a lifestyle which will result in healthy aging and less problems in the later years of life. So, tenets of preventive medical care and health care, the earlier they are embraced in one's life journey, the better would be the autumn years of our life. So, when does one go and see a geriatrician? It is best to see a geriatrician when one is or perceives oneself to be healthy. You should not wait for an illness to come and then go and see a geriatrician. You could do that, but the best time would be when you perceive yourself to be healthy, because then the geriatrician will have the time and the right kind of environment to do a thorough, comprehensive geriatric assessment, which includes the cognitive function, the emotional state, and all the different organ systems, and formulate a problem list where all interventions can be required. Bigger centers have not only the geriatrician but also a team of healthcare providers, which includes trained nurses, physiotherapists, nutritionists, and medical social workers who will also assess the elderly person along with the family members and come out with a very comprehensive problem list and a care plan for the person after a team meeting, which provides even better care for the older persons he or she ages. So the geriatrician and the team, after having assessed you and known your overall condition and your wishes, will then not only continue to provide all the basic care for healthy aging, manage the proto-illnesses like diabetes, hypertension, stable cardiac disease, stable kidney problems, endocrinological problems, etc. But he will also advise when the person has to see a particular specialist in any field where more expertise is required in the treatment of that particular condition. And then the geriatrician will incorporate the suggestions and advice in the overall care plan of the person, and that is very important. The geriatrician will also act as your advocate, your healthcare advocate, so that if you are advised a procedure or an intervention, the geriatrician will evaluate what impact it will have on your overall health status, your quality of life, and your life expectancy, and give you the necessary advice on how to proceed in that particular situation. So I will conclude this session now and once again invite your comments, queries, and suggestions. Bye for now.